So for those of you I haven't met, my name is Allison Warren. I'm the Multimedia Public Relations Specialist here at Sarasota Memorial Hospital. And we're very grateful that based on all the questions we're getting about COVID-19 and its effect on our community, that Dr. James Fiorica and Dr. Kirk Volker are able to join us today to answer some of those questions. Before we get started though, I want to offer each doctor the opportunity to kind of talk about what they think is most important that the community hears right now about COVID-19. So Dr. Fiorica, if you can just talk a little bit about what you're seeing and what you think is the most important information the community know.
Well, I think we're just finishing the 4th of July and everybody's, trying to do the best they can, but I think we're going to see our numbers continue to grow. If I just look at where we were a month ago and I look at where we are today, our numbers are continually increasing, and I think that's our biggest concern is obviously capacity and how do we have people social distance and wear masks, and I think that's our issue is where are we going to be in 2 weeks from now.
Thank you, Dr. Fiorica. And now we are going to ask Dr. Volker if he has anything he really wants to highlight for the community.
Yeah, and it's echoing what Dr. Fiorica said in that, yes, this is real. Yes, COVID is increasing significantly, and everybody has a responsibility to do the appropriate thing, which right now is wear masks, go ahead and wash your hands almost obsessively, and limit your group interactions.
All right, thank you, Dr. Volker. I will just go in alphabetical, the order that it's appearing here. So we'll start with questions from Allison.
Hey there, good afternoon. Yeah, so today I wanted to talk with you both about plasma donations. I know the blood bank has been pushing out that they're critically low. I talked to Kim this morning and she had mentioned that you guys don't have enough to treat the number of patients that you want to treat with it. Can you talk about the importance, how this is really one of the only known ways that we can help treat these patients and perhaps keep them out of the ICU from things getting worse? Can you kind of just talk about where SMH stands right now and how it's challenging, when the supply just isn't there?
Jim, do you want to take that? I'll say from my perspective, from the sort of ICU perspective, we are in desperate need of plasma. We have a bunch of people who have recently been diagnosed with COVID, which gives them a opportunity to save, every time you donate, you can save 4 lives. It is one of our mainstay medications treatments for COVID, and we are running critically short on it. So it's an appeal to the community. If you know you've been positive, please consider giving.
Dr. Fiorica, did you have anything you wanted to add?
Yeah, so remdesivir, the question about treatments, and as Dr. Volker mentioned, we try to hit these sick patients with everything we have. Remdesivir is one of them. The dexamethasone they've talked about, convalescent plasma he just talked about. The remdesivir, it's a little disappointing that we can't have access or more access to it. We were very proactive a month ago. Actually, we started the study because we wanted to gain access to a new and promising drug, and we did that very well. Unfortunately, that study closed and has moved on into a more public eye, and so it's limited our access just because of the shortage. We do have other treatments. We still have some access to remdesivir, and we're trying to get as much as we can to treat. And we're looking for new treatment options. We're constantly looking for new drugs, and I think that's what you're going to hear in the future is what new drugs, promising drugs we have in addition to what we have available, because we want to give these patients every chance possible.
And can you talk about when you say critically low, I mean, not enough? Is there like numbers that you are able to quantify? If we have this many patients, this many need them, and this is how much we have to treat them. I mean, I don't know if it's someone who's in worse shape that you give it to. I don't even know how can you kind of explain the process of how you decide who gets this and who doesn't when you are so critically low?
Sure. Now it becomes a matter of rationing. Before, when you came into the hospital, if you required oxygen or were short of breath, you would get the convalescent plasma. Right now, we are going to have to start looking at how sick are our patients. Are they on higher amounts of oxygen? Are they on the ventilator? Are they deathly ill? And we're going to have to start stratifying who gets it. We have not had to do so till this point, but if we do not have the supply, then we have to ration.
I guess just, oh, if you wanted to continue, go ahead.
Convalescent plasma, it's type specific. So anybody that's obviously been COVID exposed, they can donate, and for every donation, we can usually treat 4 patients of that specific blood type. And so that's where we're into situations like what blood type do we need and what type do we have.
Well, I think that's kind of the main step for me. I was just seeing if you guys could quantify it. I mean, obviously we're seeing the cases in Florida continue to rise, and you'd hope that with more cases that more people would be going out to donate this plasma since they have the ability to do so once they are, clear of their symptoms and whatnot. So it's kind of just the call to people to do so and be aware that they can help save some other lives with limited treatment options.
Yeah, and thank you for bringing that up.
And Dr. Volker, just to clarify, can you talk a little bit about what the process is, who can give? It's not just if you've had COVID, you have to test negative afterwards, correct?
So you have to have, it has to be 28 days after your symptoms that you can donate. So we're getting this spike, and those people can donate, 28 days after their symptoms or after they're tested positive. They may have a prerequisite that they have to test negative at the blood bank. And now there's some controversy there because people can test positive for weeks after they've been exposed.
Okay, and I actually was just getting the nod that I had it wrong, so you don't have to test negative. Thank you, Dr. Volker.
Okay.
Next, we will go to Angie.
Hey there. I'm just checking in about bed capacity and how we're doing to date. I know we had last week a big spike, I guess of almost 6% from where we were in May. I'm curious what our ICU capacity is at this moment.
We still have capacity. The capacity isn't the issue, it's the trend that's the issue. So as far as the hospital census, we're at 581 today. Total patients in the hospital, and we have 78 COVID's positive patients in the hospital today. Regarding ICU, we have 16 ICU COVID positive patients, and 12 of them are on ventilators. Yes, we have 62 bed ICU, and we have capacity to bring that up over 100 if we have to, ventilators. But obviously when you do that, you stress the rest of the hospital because you're moving other patients around to do that. But yes, we do have capacity. It's the trend that we're concerned about.
Awesome, thank you. So you said that you have the capacity to have over 100 patients in the ICU if needed, and right now you have 16? Just want to confirm I understood that correctly.
Correct. We have 62 ICU beds right now. We have 16 COVID positive patients. So yes, we have the capacity to treat, but remember we have other ICU patients as well. So 2 of our ICUs, and I believe they just opened a 3rd ICU pod for COVID positive patients. So yes, we can do it, but we're also juggling our other ICU patients as well.
Now, is this the highest number we've seen yet of COVID positive patients at SMH?
Yes, it is. We jumped from 6 patients to 78 patients between the beginning of June. I mean, at our lowest point, we were 6 patients. We're 78 now. The month of May, our peak was, our highest was 43 patients. So we're clearly gone from our previous peak of 43 to 78 patients today. So we are seeing an increase for sure.
Awesome. Thank you. I think I'm all set. Thank you.
Okay, next up, Becca.
Hello. I wanted to touch upon, you know, the increase in cases for younger people, majority 0 to 19-year-old. I saw that over the weekend. There was about 300 cases in our area of kids testing positive for the virus. What's the protocol with that? Are you guys seeing any of these kids having to be hospitalized, or is it majority, like we've been saying this whole time, the people that are older that are at risk?
You're absolutely right. What you said is clearly right. The younger patients, we've seen clearly a shift. Now we see patients in their 20s, 30s, and 40s that we weren't seeing back in March and April. In March and April, when we look at our previous data, our average age was 70 years old or older. Now our average age is 49 for the month of June, where half of the patients are less than 50 that are being admitted to the hospital. And so your point is well taken. I think one of the myths is people think that I'm young, I'm healthy, I can't get this disease, and that's just not the case. You can contact it, and not only can you spread it, you can become quite ill from this disease as well.
What about children?
Oh.
Sorry.
Yes, we have had some children as well. Not as many children, infants that have turned positive, but we have had some for sure.
Dr. Volker, did you want to add anything to that? You have to unmute, Dr. Volker.
Yeah, from the intensive care unit, we are seeing a decrease in the mean age. It used to be that patients were in their 70s and 80s. Now we have 2 patients in their 30s. I had a 19-year-old. So we're seeing younger people. Now the average age is probably in the low 50s. And so, yes, we are seeing younger people, sick people younger. Because one of the concerns is that, you know, younger people think, well, I may get it, but I'm not going to get that sick. We are starting to see sick younger people. That's the message.
Why do you think there was this shift all of a sudden?
I think it's because younger people went out, they congregated, they gathered, they did activities like on Memorial Day, and it's just the spread of the virus, you know, and that they think that they're impervious to it and not doing the appropriate social distancing, wearing masks, and washing your hands.
Dr. Fiorita, did you want to add to that?
You're absolutely right. This is
Oh, Dr. Fiorita. Dr. Fiorita, you're muted. You have to there you go.
Dr. Volker said is absolutely true. We are seeing younger patients. We have more ability to test, but that's not it. Just testing positive is one thing. When you're seeing hospital admissions, that's another thing. That means they're sick. So it's not just young people are testing positive. We're seeing them in the hospital. So that's real.
And one last question. What about pregnant women? Have you guys seen a lot of them having to be hospitalized?
Dr. Volker, you want to take that one?
You know, I haven't seen them in the ICU, okay. So I'm going to leave that to Jim. I think we may have had one pregnant woman in the ICU, but I wasn't taking care of her, so I'm not sure.
Dr. Fiorita? You're on mute again. You muted yourself.
Yes, we have had some pregnant patients. Right now, we're actually screening all pregnant patients that are coming into the hospital in labor are all being screened right now. Yes, we have had positive patients. We've had deliveries, cesarean deliveries. Not a lot, fortunately, but we have had a couple of them. So we are taking precautions, and yes, you can see it in pregnancy.
Thank you, Dr.
Good to go.
All right. Kim?
So I guess my question would be, what is the concern if people just continue doing what they're doing, disregarding this virus as we've seen some people do? I guess what's both of your main worries if we continue down this path that we're on right now?
Dr. Fiorica, you want to start that one?
I'm sorry, I think I missed the question, something about the concern.
What's your concern if we continue on this trend that we're seeing right now, and if people kind of continue to just go about their lives without really thinking about this virus?
Well, hospitals are, the hospitals will fill up around the state of Florida. It's not just Sarasota. We're actually doing quite well. We've done well staying ahead of the game. We just want to continue to stay ahead of the game. The good news is the state and the county health department in the state have done a wonderful job. They've just recently opened some isolation facilities to help us, transfer our inpatients that are ready for step down to another facilities, because it takes a long time for a patient to be able to be transferred to an intermediate facility like a skilled nursing facility. And so that's why we're asking the state. They are doing a nice job trying to make that better, but it's really capacity over time that we're more concerned about.
Dr. Volker, your concerns?
Yeah, it is a concern of overwhelming the system. We have 100 ventilators. We've got the capacity to significantly increase our ICU beds. But then the question is, what staff do we have? And so that is one of the concerns. The other concern is that this virus is a formidable foe. When we let up on all that we were doing to suppress it, it came back with a vengeance. That just gives you an idea of what we call sort of the receiver operating curve of this virus. And so it's gonna be with us for a while.
Kim, did you have any other questions? Okay, great. Samantha?
Sorry. Yeah, you talk about that we have plenty of space right now, but if we continue on this trend, how quickly can we run out of capacity right now?
Dr. Fiorica?
That's the unknown. We're doing fine now. It's the unknown. The challenge is, for every sick COVID patient, they may be in the hospital for a month, and that fills beds unless you have a place they may or may not be able to go home. Now the good news is most people aren't in that long. But these ICU patients, they're in for a long time. Dr. Volker can talk about time frames, but they could be in for a month if they end up on a ventilator and the whole process step down. That's where we run into challenges. We're doing well now. We haven't had that, but that's where we're trying to find some other avenue to make it better, either through new therapy for treatment, to try to sort of soften that disease, or to find a facility that can take them while we're allowing us to, add more patients into the hospital.
Did you want to add something, Dr. Volker?
No, I agree with what Dr. Fiorica said.
Okay, and this is something where, we're, like you said, we have enough capacity right now at your hospital. You're one of the only hospitals right now in the area that is actually giving us the hospitalization numbers and giving us a clue about what the sickest patients in our community look like right now. Why do you think it's important for the rest of the community to know what it looks like in the hospital right now? Because, we're still seeing a lot of resistance to social distancing guidelines and things like wearing masks in the public right now.
Dr. Fiorica, you want to answer that one?
I can't speak for anybody else, but we try to be as transparent. We try to let everybody know, and we let our employees know. We let the physicians. We have active communication lines. We just do our best. I think it's fair to let people know what's going on, and I have to say the community has stepped up to help us. I mean, they really have helped us, and we're hoping the community will continue to do that. That's the best thing we can ask for.
And we are still seeing some resistance to people who don't want to put that mask on when they go to the grocery store, or they are gathering in larger groups. What would be your message to those people?
Okay, I'd like to give those people a little bit of a primer on this whole thing, in that, what data do you look at? What do you believe? And so the total number of cases, that could be just a function of testing. But if you look at percent positive, how many of those testing they are positive, we went from 0.5%, a half of a percent, up to 8% now, which is just about what it was at the peak last time. And then the next thing you look at is hospitalizations. And it is very difficult to get hospitalization rate off of the Department of Health website. And you almost have to do it day by day. But if you look over the last few weeks, we've gone from 0.5 to 1 patient a day, 1 patient a day, 2 patients a day. Now I think we're up to like 4 patients a day that we're admitting on the average. Those are real trends. That is irrefutable. So those that think that this is a hoax, you're just wrong. Wear your mask, do the right thing for everybody else.
Dr. Fiorica, you want to add anything?
Yeah, I'd like to just say that, if people don't understand sometimes they don't understand the statistics, but if 80% of people in the community wore a mask, that would be more effective than a lockdown. You would be able to control the disease much more effectively if the vast majority of people wore masks than the way we were, a month or so ago. It's just a better way to do it. It allows us to stay active and still be able to control the disease.
Yeah. So basically, the way I see it is that if you want to maintain your liberties and be able to go out and do the things that you want to do and not have the city shut down or the county shut down, just wear a mask, wash your hands, do the right thing.
Sam, did you have any other questions?
No, I'm all set. Thank you.
Okay, so that does it. I don't think I missed anyone. If I did, let me know, but I don't think I did. Thank you all for joining us and helping get the information out. And thank you, Dr. James Fiorica, Dr. Kirk Volker, working closely with our entire medical staff to keep treating these patients and informing the community. So thank you all. Stay safe, wear a mask, stay healthy, and have a great rest of your day.